A strange side effect from the pandemic, Bay Area emergency rooms are nearly deserted. KPIX 5's Jackie Ward joins us from UCSF to explain why patients, for the most part, are staying away. Jackie?
Ken, a quick survey of Bay Area emergency rooms really tells the story. Patients, even those with life-threatening conditions, staying far away. It's not just the virus that's spreading, it's the fear. From John Muir Medical Center in Walnut Creek to Stanford Healthcare on the peninsula, emergency rooms around the Bay Area appear to be unusually empty.
We've seen a 40% drop in the emergency room visits.
You know, this is a phenomena that's being seen throughout the East Bay.
Our volumes are significantly down from normal, and that's what is being seen across the entire Bay Area.
KPIX News surveyed local medical centers. We found visits to Bay Area EDs have dropped anywhere from 30 to 50%. Some patients who really need emergency care are not showing up.
Well, we started to notice that there was almost up to a 50% reduction in patients who come in with acute heart attack.
In our own community, a couple patients who had symptoms of appendicitis unfortunately didn't come in and unfortunately had those ruptured by the time they arrived.
As to why?
The fear of going where other people were definitely had the virus.
Vanessa Johnson has asthma as well as a history of pulmonary blood clots. Her mother, Sarah, has multiple health issues. A few weeks ago, they decided during this COVID emergency to stay away from the emergency room.
We were very afraid of going to the hospital and decided to stay home.
The consequences for some patients, those with heart attacks and strokes, can be deadly.
There's a certain window in which we know we can give the best treatment.
But by the time they came in, we were really not able to help them.
Yesterday, Governor Gavin Newsom announced the first shift in reopening the state. Hospitals can soon begin to schedule certain essential surgeries. Now ERs want to remind the Bay Area.
We're open 24/7.
You are far safer being in the hospital for your stroke or your heart attack than you are at home.
With the flattening of the curve and with strict medical policies in place, Vanessa, who volunteers at Stanford, has now shifted her position.
I would go and she would go now where we wouldn't have before.
One reason there's a drop in emergency room visits is because there are fewer traffic collisions. In San Francisco alone, the city is reporting that compared to last April, this April, they're seeing a drop by 50% in traffic accidents. In San Francisco, Jackie Ward, KPIX 5.